My name's Iris Mwanza. I'm the Deputy Director of the Women in Leadership Work at the Bill and Melinda Gates Foundation. I'm just delighted to be here today to discuss this really important topic of women in global health research. We know that there's been progress, and big thanks to the hard work and heavy lifting of the Global Health Network and others. And I have something very, very special to announce today. If you look on your seats, you will have a piece of paper. Yes, yes. Don't sit on them. Take a look at them. And so we are launching today a new community of practice for women researchers in global health. Yes. Super exciting. Everybody is invited to be involved and participate and join this community. It's our community. So thank you, Trudy. Thank you for everybody for making this happen. Okay. So today we have an incredible group of panelists for you, and they in just a couple of moments are going to be introducing themselves and talking about their work and their personal and professional journeys. By the end of the session, you're going to be inspired, but in addition to inspiration, you're going to have some good ideas, some recommendations, some thoughts, food for thought to take home with you back to your home organization. I know I'm going to take some of this back to mine, but also back to your home countries. The goals of this conference, as you know, aren't just to have an overdue celebration, even though that's a part of what we're doing, 10 years plus. Yes, we can clap for that. To convene, to dance. Nobody told me to bring my dancing shoes, but next time I'll get it right. But more importantly, we're here to have meaningful conversations. We want real progress, and we need to accelerate our goals for gender equality and women's leadership in global health research. As many of you might know, it's the Thanksgiving holiday in the US, and the US is my adopted home, even though I'm originally from Zambia. But I want to take this time to just express my profound gratitude to all the organizers. So much hard work went into making this convening the success that it has been. Yes, absolutely. Thanks to my panelists in advance, and thank you to this audience. Just such a beautiful audience. So thank you for your active participation. I do have to say I am a little bit sad to miss the annual Thanksgiving feast that my in-laws put on, but it's a very, very, very small price to pay for this wonderful honor and tremendous opportunity to be with this family and this community. So really, really happy to be here. Before we get into our panel discussion, I want to take just 1 minute to say how proud the Bill and Melinda Gates Foundation is to have partnered with the Global Health Network since its inception, so 10 years plus 2. And the foundation will continue to support this important work into the future. The team that I lead is all about women's leadership. And my job and my passion is to accelerate women's leadership in health. I have the privilege of working with a remarkable team, and we promote women's leadership in global health, in law and economics. But I also work with many, many other teams in the gender equality division. And our collective objectives are around achieving SDG 5. So I won't pop quiz you and ask you what SDG 5 is. I think the majority of you know, but in case you don't, the goal is to achieve gender equality and the empowerment of all women and all girls. We know that gender equality in research is the absolute right thing to do. But we see in our work that equity and equality also leads to stronger, more robust research, which in turn leads to better health outcomes for all of us. The Global Health Network has been so effective at strengthening the capacity, the quality, the diversity of both the researchers and also research. They've done this across disciplines, across the globe. And this session is going to explore both the barriers and enablers of women in global health research. So now, turning to my wonderful panelists, we're going to kick off the session with you introducing yourselves and your work, starting with you, Lyda.
Shall I use?
Yes.
Hello, thank you, Iris. And first of all, thank you for the organizers for inviting us here and bringing us all the way from Colombia and giving me the chance to meet up with my colleagues of the Global Health Network Latin America and the Caribbean, but also encounter again people that have been very key to me early in my career, both women and men that I have seen here for the first time in many years. So thank you for that opportunity. I will never forget it. My name is Lyda Osorio. I'm an infectious disease epidemiologist at Universidad del Valle in Cali, Colombia, where I do research in mainly arboviruses, neuroinflammatory infections, and also are very motivated to share the privilege that I had to have access to a PhD and postdoc training. And I want to give back that to my fellow students and also younger generations in Colombia to have the same privilege. And that sometime in the future, higher education is no anymore a privilege, but a right. Thank you.
Hi, good afternoon. Thank you, Iris, for the introduction. It's a pleasure to be here in this lovely panel. And my name is Cristiani Machado. I'm a researcher. I was graduated in medicine, and I'm a public health researcher at the National School of Public Health, which is a scientific unit of Oswaldo Cruz Foundation in Brazil. I'm currently the Vice President of Education, Information and Communication at Fiocruz as well, where I have many responsibilities, including the coordination of the Women and Girls in Science program at Fiocruz. That's why I think I'm here representing the institution. I'm also the mother of two girls who were born while I was at my doctorate, both of them, and now they are at the university. So everything worked out perfectly. Thank you.
Cristiani just ended with a reflection of successful women. So we'll talk about it later. So I'm Aliya Naheed. I'm a medical doctor, but I was a disease epidemiologist. I am a disease epidemiologist. I have 15 years of track record in infectious disease. And I was frustrated looking at the epidemiologists not being interested in translating research finding into policy. Then I pushed myself to get into health systems management. I am a specialist in there. My main focus is now non-communicable disease, health systems strengthening, and of course, service delivery, including equity and gender equity particularly. So I don't know what I should say. I am a scientist in International Center for Diarrheal Disease, the organization is famous for its invention of oral rehydration solution that is saving millions of lives in the world. So from that organization, I probably don't need to talk much about it, but just all I want to say that there's a huge number of women researchers working there. And this organization in many other organization developing countries is making solutions for problems, but which we don't know. So it was a great forum in the Global Network Conference that knew about it to some extent. So look forward to hearing the story and challenges and the success behind those for those women. Great to be in the panel. Thank you.
Thank you. Good afternoon. My name is Alice Lakati. I work for Amref International University. Amref International University is born of Amref Health Africa, which is an NGO that has been there for over 65 years in Africa, implementing projects in primary healthcare. We are actually in 35 African countries. So the university was formed 5 years ago to complement the work of Amref in terms of advancing the agenda of human resources for health. At the university, I have taken different roles where I have founded different sections of the university from scratch. I founded the School of Public Health, the Department of Community Health, and now I'm the founding director for Community for Research and Extension. I'm delighted to be in this panel, and I'm also greatly honored that we have the privilege to discuss and learn from each other. Thank you.
Good afternoon, everyone. As you can see, I'm a man. My name is Thumbi Ndung'u, and I'm director for Basic and Translational Science at the Africa Health Research Institute in Durban, South Africa. But I'm also program director for a research and capacity building consortium known as the Sub-Saharan Africa Network for TB and HIV Research Excellence, which brings together 8 African institutions for research and capacity building around HIV and TB. And yeah, I'm looking forward to this discussion. I was really horrified to know that I'm the only man in the panel. And so the tables have slightly been turned on me for this one, because usually it's the other way around.
Good afternoon. I'm Katherine Littler from the WHO Ethics and Governance Unit in Geneva. I'd like to, I think, thank the organizers for the invitation, but I'll tell you that in about 50 minutes. But I had the classic female reaction when I got this invitation. I did that, oh, I'm not an expert. Should I sit on this panel? And that was my first thought. And then I thought, by virtue of my gender and my experience and my role looking at ethics and access issues, maybe I'm well qualified to sit on that. The second thing I did was thought about who are my role models, like who have been my role models in this space. And what's really interesting is now I've got some. So the last session was Nikki Mulder. I had the privilege of working on H3 Africa, and she has to be one of my role models. I'm also currently situated in the science division, and we have the inaugural chief scientist, Dr. Sumi Oswaldo, and I have to say, watching her in COVID, which would have to be one of the toughest jobs to be the chief scientist at the WHO during COVID, watching her humanity, watching the way she handled really tough questions, gave information really well. I just, I have an utmost respect for her. So it's really nice to have someone at the top of the organization or very close to it, female, that I can look up to. But when I was looking back in my early career, there weren't many people for me to follow. And I do think that's tough. I actually think that's really tough. And when I was speaking to Iris at the beginning of this, before the session, I was thinking, this is a hard conversation because it's not about an add-on. Gender is not an add-on, it's a systems issue. So pulling it out and teasing it out, like ethics, people often roll their eyes when I say I'm in ethics. That's a systems issue also, and so is gender. So I think part of this discussion today is challenging ourselves on the systems issue and our responsibility. So I'm really looking forward to the panel and hearing from my fellow experts or the people who are actually embedding policy so I can learn how to be better in this space as well.
Great, thank you, everybody. So we're going to get stuck in, and we're going to open this discussion in Latin America. So again, starting with you, Lyda. You're a professor, you're an infectious disease researcher. You've previously talked about your experiences as being a scientist before motherhood, and then being a scientist after motherhood. So what do you mean by that? And please, could you just share more about your story and your journey?
Yeah, our careers are at the forefront of our list of priorities, and then comes motherhood to fight that first place. And for me, it was a struggle, that fight. And sometimes I feel guilty when motherhood was on the top and for not doing research. And then when research came up first, and I felt guilty because I was left in my son alone, quotes, which means without me. And he wasn't alone. And, or it was neglecting him. I thought that's what it felt in my mind. So there was a struggle there to find that balance. And for me, I think it was the only time in my entire career that I felt some sort of discrimination, because I thought that was unfair. That was me who was having that struggle, but not my partner. At least he didn't communicate that way. So I thought it was a need to discuss in society how we value care for the kids and for the family, and how much burden is put in us women. And it's up to us to actually educate the kids very early on to be able to share the care of the family, and also housework. So it's more balanced. And also the workplace, how can be more friendly for us to find a better solution to that dilemma. And fortunately, I have the support of my workplace, the university. So I had the flexibility to manage my schedule, work from home. Also, we have good maternity leave laws in Colombia. And also, I think I have also the support, and my colleagues was very important to cover me, and also to be flexible when I have to leave a meeting early because I needed to be home, for example. I think finally, it was my decision to restrict traveling. I think that was my own decision, and it has to be worth it, like this one. It's for me to leave home, or if it's gonna be short, I won't travel. And I'm very keen into virtual meetings and virtual teaching, etc. So I think that's at the end was the only decision that I took. But I have friends who have decided to completely stop their careers and dedicate to motherhood. And I think that's completely, I respect that. It's their decision, and that suits their interest. But then it has been a struggle for them to come back after certain years. And for them, I think we still to work harder into how we facilitate the comeback after motherhood as well. Thank you.
Okay. No, absolutely. We have heard and we know ourselves that there's an unequal burden of care that's falling on women around childcare, as you mentioned, but also elder care, caring for sick relatives. I think a recent ILO study said that depending on what country you're in, the burden of unpaid work that women carry versus men can be 2 times up to 10 times the amount for men. So this is a very significant, very real issue. So Mike, and we know, and I think COVID, it just exposed the reality. It wasn't something that was new, but I think it brought it to the fore because what had been a struggle became completely unbearable. So you did mention that your university was a conducive place for motherhood, and you now are in a leadership position. So please, could you share with us ways in which you've been successful, either yourself through the university or at the national level in initiating change?
Yeah, I think as you said, I'm in a privileged position, which shouldn't feel privileged in the first place. But anyway, I think first I needed to be better educating myself. And I had this anecdote when I was interviewed for gender disparity survey within my university. And all the replies were, no, I haven't felt that. And at the end of the survey, I was asking, why are you doing this research? The university is so balanced, it's so good. I have experienced that myself. And then the researchers show me the data, the difference in salaries, in the amount of work. And I was like, I was illiterate about my own gender position in the workplace. So I felt the need to educate. So one of the things that I started to do was to educate both men and women And I ask you that to be please more educated in the data that is actually our data showing the imbalance, not only in gender, but other minorities, minorities of people that is underrepresented in research, and then how we can improve that. So the way I've done is to talk about my experience, I think is the first, to share it. I usually don't talk about myself very much, so it has to be an effort to do that and share it with my students, both men and women, and also to raise up the women issues in every meeting. One of the things that I think has changed a lot is to trying to understand that women, we don't necessarily have to dress in a certain way or speak in a certain tone of voice to be able to be heard, and to respect and make ourselves be respected in our opinions. And if you need to speak loud, I think you have to do it. It doesn't mean that you're aggressive, as that's what usually the society makes us to believe. And I think for me, what is the impact is when I see my students who are pursuing their careers. So for me, that's the big change. And they are able to balance, to find balance in their working and family lives.
Great. Thank you so much. So we're going to move down the line to you, Cristiani. What are the main challenges you've seen in promoting gender equity in science in very unequal countries like Brazil and some of the other similar Latin American countries?
Well, the first challenge is that Brazil and other Latin American countries are very, very unequal. And so gender inequalities are deeply entangled with other dimensions of inequalities: income inequalities, class inequalities, racial inequalities, territorial inequalities. And so it's really hard. You have to work with comprehensive policies, public policies, to reduce inequalities, and also to adopt affirmative action in several different areas. Otherwise, girls and women will have less chances to choose what they would like to study and to work with. And because moreover, they are frequently victims of harassment, of domestic violence, of kinds of discrimination, because most of our societies are very patriarchal. And so there are lots of structural inequalities in this way. The second problem is that in science, for example, now we are approaching, in Brazil at least, some equilibrium between women and men in science in what regards the number, the quantitative number. But when it comes to the power positions, men are prominent. You know, even in institutions that are very progressive, as mine. We know we have a woman as a president for the first time in 120 years of Oswaldo Cruz Foundation. And we have 5 vice presidents, and I'm the only woman, the other 4. So the president is a woman, and we have 4 vice presidents who are men, and I'm the woman, the only one who is a woman. And so this is very unequal. We have data on that from the students to the top level. And this happens in politics, this happens in business, this happens in public administration and in our institutions. So we have to articulate comprehensive public policies with institutional policies and pro-equity measures to face these challenges.
Great, thank you. So I think for a lot of people, it's overwhelming. There are just so many problems. And we've talked about systemic problems. We've talked about legal policy problems. We've talked about institutional problems. So what lessons can we draw that are sort of pragmatic that you've learned from your experience at, I'm going to mess up the pronunciation, but Fiocruz?
Fiocruz, that's perfect. In Fiocruz, we have been working with gender equality initiatives. So we have a committee on race and gender equality, pro-equity, gender and race equality committee since 2009. And since our president was elected in 2017, she considered this a priority in her agenda. And so we launched a Women and Girls in Science program in 2019. And this program we have been working in three main lines. The first one is to recognize the women that are the scientists, the women who are scientists at Fiocruz, to promote their work and to make their work visible. And so we have this memory, the institutional memory initiative, which makes videos and tells stories, and we have many initiatives in this way. We have produced a little marketing, okay? A dossier about the program, which has its main initiatives. It's in Portuguese, but I have some postcards here. And so this is a very important line. We have also this, it's an example, I brought some example. This small book is his stories to inspire future scientists. We have 12 stories about Fiocruz scientists in a very logic language, aimed to reach girls. So we work with storytellings, with programs. And so our second line of action is the More Girls in Science program, in which we work with girls in elementary and in high school. So we have some programs to attract girls to know better about science and about the possibilities of the science profession. And we've been working that in all states in which we have Fiocruz, 11 states, we have Fiocruz institutes in 11 Brazilian states. So we've launched this program, and the researchers are very engaged in promoting initiatives and with schools, with different social organizations. It's really a beautiful program. And the third one is promoting studies about gender and science, equalities, inequalities, and its repercussions on science, and promoting debates in the society. Academic studies about that, and also debates to influence public policies and to exchange experiences with other institutions. That's it.
Great. I love that, because our hypothesis and the work that I lead is that if we can get women into leadership positions, they're going to take care of the rest. And this is a brilliant example of exactly that. So we're going to leave Latin America and go to Asia. My next question is for you, Aliya. I'm sure some of what Lyda and Cristiani is really resonating with you. But I do want us to explore what is similar with Latin America and what is different in your experience in Asia.
I don't know whether it is a good news or bad news. What I just heard from Lydia and Cristiani, I see no difference what we see in Bangladesh or in other countries in Asia. So it is, their social inequality is there and the gender inequality is there, but it does not start when a woman is coming to science profession. It starts when a woman is going to an education system. And it is the parents who decide, at least still in our countries, parents decide what the girl should study. Maybe boy has some says, but the girls, not always. And when girls go to university, when they have a chance to choose a science, I think there is some pressure also. And taken, for example, if someone comes to science, they come up with a dream, but dream gets destroyed after their marriage. If the person who she is getting married to, or his family, the family he's getting married to, is not supportive about the profession this girl chooses. Even doctors, I have seen the medical doctors and engineers, they left profession. They are doing something else. It is such a waste of the national investment that happens a lot. So what the similarity, like both Latin American countries, I see. So women voice is not heard. And unfortunately, my experience is that in our societies, it is the women in the families who are supposed to guide them. Their voices are not raised for their girl children. I think so. This is sort of male domination is still there, but I should not say it is picture for everyone. And there are many men in our countries that support the children irrespective of the gender. And these girls come out, and I have seen many girls on their own choice. They really don't take the hardship way. They try to do easy things. Maybe society also support. You will see very small number of people coming to science, technology, economics, mathematics, right? STEM science. So social science, there are a lot of interest and people go there. So this, I think this is also not different in other countries. And so I see similarities as in that ways. I don't know what I would say as dissimilarity. I think one of the dissimilarity, I don't know whether it's true, I didn't hear that, but what I see as a general women's status, if I talk about Bangladesh, general women are respected in the society. Maybe in professional world, what they choose, this is a different. And when they grow older, they have more empowerment than they are younger. So the women who actually survive in their professional role for certain ages and that come to a middle age, I think that is the time when they jump, when they fly. And all the women I see in my country, I see those are persistent fighter in the family, in the society. Despite all those negativities, they actually stay in their profession, in their career, even in science or in business, whatever you say. And they really fight against women and men and try to run side by side. So in that sense, I say that this is, I don't know if it is true for Latin America, but I see this as a positive notion in Bangladesh society. Thank you.
Yes, I think there's a lot to be said about perseverance, but you have obviously persevered. You've obviously overcome many of these obstacles to be phenomenally successful yourself. You have also done, I think, an incredible job of raising money, which is part of success in research. We have a lot of beautiful young men and women who are starting their careers. So what advice would you give to them? What advice do you wish that you had in addition to perseverance, particularly for the young women researchers who are just starting out?
Beautiful question for me, because even when I was very young, I always wanted to mentor other women, which is not usual. And I would say that I have started my professional journey back in 1994 when I completed medical education. I did not choose any other profession. I directly came to my organization, icddr. That was my first job interview, first appointment, and first job. I never looked back. I really wanted to be a scientist, and I'm so happy I could be. But when I joined the organization, I never could believe I would come to this level ever in my life, because I have seen there is no support. Like, I think it is true for both young men and young women who come to a professional like research organization. So they are sort of told, you need to do this, you need to do that. And I didn't see an environment where I could say, I want to do this, or this is my dream. And it took me about 7 to 10 years just to get my master's degree. So the first advice I would say that for any scientist or in professional research, particularly in research, you really need to have the research training. And you better get this as early as you can. So when joining an organization, any research organization, I'm talking about science. So it is difficult for her to choose which team she should work. But when there is a chance, this young lady should choose a team where there is a mentor who actually encourages career development of the juniors and create an opportunity to take a leadership role. This is very important. And what a lot of people think in the society, even in our society, that maybe a female mentor actually promotes a female better, a male mentor does not. But in my reality, I really didn't see any difference. So it is actually the person who chooses. It is difficult, but this is really important who you are choosing to work with, because that person will not guide you, but create an opportunity, which as a young person, it is very difficult to create. And the second thing, I see a lot of young people, either out of frustration or out of work pressure or out of not meeting their dreams, they leave the research organization or job. But the research is such a job that you cannot get benefit in just a few months or few years. It is a lifelong approach. So perseverance in sticking to the career is also important. So I would encourage you who are in the early career stage, don't leave your job in the middle because you miss the opportunity to learn the research cycle. A research from generating a grant up to publishing a paper or translating into policy. This is a huge pathway and it doesn't happen in a year or two. It takes time. So I would highly encourage wherever your stage of professional career is, stick to the process so that you learn. And research is such a thing. You have to do research to learn research. So there's no other way. Doesn't matter how many degrees you may have. That is the other thing I should say professionally. And so getting education is very important. But other than education, what I would say that when someone gets a education, MPH, and then there are a lot of women who think, okay, if I get an opportunity to get a grant, I will get it, or I will work with other people. If I'm given opportunity to write a paper, I will write that. We have to come out of this. You have to drive yourself and push yourself to motivate other people that, yes, I want to write a grant. I want to write a paper. I want to do analysis. A lot of people cannot dare to do that because they don't have the skill. Again, the training comes into play. If you train yourself enough with study methodology, analytical analytics, you will be empowered to do research. So that is the first point. Educate yourself, and trust me, nobody drove me to go for education. Nobody told me that you need to get training. I found it out after 7 years that it is a waste. I did not get training to do my job. Then I had to fight for it. But when you do that, you come to a middle-aged career. So this is my second advice for all of you. Middle-aged career, you're coming to a leadership role. Don't just try to be a team member or be a leader, and try to do things that you can lead, and let other people to support you. But being a leader, a lot of people think it is bossing, which is not bossing. You have to share responsibility with others so that you can mentor your teams and your colleagues. And you have to be very open, reaching out to successful people, either successful male scientists or female scientists. Try to work with them, try to create an association with them, learn from them. Because if you just have a cup of tea or have some social interaction, you will learn from them. Just from hear the story, what they say, they will give you a lot of tips. And that will help you to decide what you can do. And second thing, I mean, in a mid-level career researcher, when you lead a research, you will, in any organization, you will be faced with a lot of challenges. So in order to mitigate that, I think the role is family. The third advice I would say, that never ever neglect your family and your own thing, because if your family environment is not in harmony, you have to take an extra pressure in my mind, and you cannot give your full potential at your work. So having a wonderful, harmonious relationship in the family is very important. But family is not, it can be parents, it can be a husband, it can be children. But there's another family, that is friends. What we don't do is we don't take care of ourselves, and we totally forget our friends, our society. We just go to work and come back and quickly to take care of our kitchen, take care of our children. I know this is tough, but at the same time, you have to give yourself time so that you go out, meet with social people, meet with friends, meet with extended families. The reason is, when you are in hardship in your professional work, these are the people, buddy, who will stand by yourself, and they will support you, be psychological support. That is very important. But one thing I should, as an advice, please never ever share your failures with, or your frustration, not either with family or with your team members. It is difficult. Share those with somebody who will not impact, because when you talk your negative things in your professional career, in your organization, in your family, they will think, oh, leave the job. You shouldn't do it. So that negativity will be coming in. So you have to be strategic where you express your emotion, where you will not be pressurized negatively to leave your professional career. So these are three advice I would say.
Thank you. And I will add a fourth to that. Now you have this community of practice for women and global health researchers. And I think it's probably fair to say, at least I know when I was coming up, we didn't have the benefit of the internet, and we didn't have access to these mentors, these inspirational women, and places where we could have these conversations. So yet another reason to join that community. So now we're going to go to Africa. And talk to Alice. You've been working as a professor as well as a researcher. You've worked across the continent, Pan-Africanist, can I say, a Pan-Africanist? And most recently, as you mentioned, you have founded many schools in Amref International University. I'm excited about the university, but I also have, I guess, a tough question for you, which is why? We have so many institutions on the continent. Many of them are gasping for resources. So why, instead of bolstering the institutions that exist, why start a whole new university?
Well, thank you. Thank you for that difficult question. But I want to say that Amref has been in Africa for the last 60 plus years, implementing primary healthcare. And for those years, Amref has learned so many things. They have learned that for you to really impact on communities, you really have to really focus on primary healthcare. And what we have seen is very few universities focus on primary healthcare. A lot of universities focus on producing graduates who are waiting to work in a perfect world, which is not actually the situation. But more importantly, if you look at the statistics, in Africa, one of the concerns that the world is concerned is the demographic change that we are facing. Africa population is a major concern. So we are going to have so many young people who require education in Africa. Even though it looks like there are so many universities, just look at the UNESCO statistics and you compare the number of universities in Africa versus the population is around, if I was referring to looking at the UNESCO statistics, it's talking about around 500 universities to 660 million African youth. While in the US alone, we have 5,000 universities for 323 million. Meaning, if we don't address the young people and give them the skills in Africa, then we are not going to solve the problems of health. Another important area is our university is only focused on primary healthcare. And we recognize from our experience of 65 years plus that only if you have a fit for purpose leader, we will not attain lasting health change. That is why we are in this space to contribute towards that. We also want to learn. We have a privilege of being in 35 countries and knowing the health systems of those countries. So we are bringing all that experience to develop a Pan-African university that is producing graduates that can work across borders. And we see this as an opportunity to learn, invent, and just like young people who really want to be listened, as a university, we are saying there is an opportunity for us to learn from mistakes and strengths of public universities and also other private universities and work with them, with many organizations.
It is so true. I take it back. We need more universities. So, I mean, one thing we know, and I think it's true even more so in African universities, women researchers are even less successful than their male counterparts in attracting funding. Is that something that you're going to be able to solve for under the rubric of Amref University or in your own experience working in collaboration with other institutions across the continent?
Thank you. Let me say that as we are launching this, our university is launching its first strategy. It's just been going on. We are launching our strategy that is 2022 to 2027. And we are focusing on key strategic areas. The first one is we want to develop fit for purpose leaders for primary healthcare systems in Africa. What we are saying fit for purpose is we want to ensure that we develop a graduate using the experience of the 35 countries who is able to work across the region. Because COVID has even taught us that diseases have no borders, and Africa remains, if it is not attended to, is a threat to the global health security. The other thing we are doing is we are looking at equity to access in education. We know that, and my colleagues have spoken about this, if you look at accessing health science training in Africa, you need to have gone to a good school, you need to have gotten good grades to be able to be a doctor and nurse. That is not happening everywhere. So you are talking about, we have a population that despite the many health workers that are trained in universities, we shall never solve the shortage of health workers because I will be trained, but I'll not be willing to work in some of the hard to reach areas in Kenya. I will work only for some time, then I'll go back. So we'll continue to have challenges in those areas. So we are building a scholarship fund to be able to target girls and communities that cannot access health sciences training so that we can solve the problem of human resources for health in those communities. We are actually starting with a program of nurses in South Sudan and Malawi. And we have been partnering, for example, in Kenya, we have partnered with some of the counties that are also have shortage of human resources for health. And we have convinced county governments that you can actually sponsor people to study in our university and you take them back to work in your county because we shall always continue to have that challenge. So therefore, as a University of Health Sciences, we hope to grow researchers that are going and women researchers that are going to really impact on primary healthcare. The other thing that we also want to be able to do, and we have learned this from COVID. For example, when COVID came, Africa took up the measures that the world was taking, lockdown. I happen to come from a community in Kenya that is nomadic. Our governments took up these policies of lockdown. So how do you lock down a nomadic community? Because we are taking research from and recommendations from the world, and we are saying lockdown. So we want to be able to drive evidence for primary healthcare that are appropriate for our setting. And that is the space that our university wants to work with you and all these partners here. Thank you.
Great, thank you so much for that. Yeah. Thank you, Thumbi. Now you know how it feels, right? For the rest of us, most of the time we are presenting in rooms and there are not that many women. So we'll try not to beat up on you too much. My question for you is, you're a researcher, you're a professor. You've been very passionate about the next generation and preparing the next generation of researchers. You're also often in rooms where women are not present. I assume, I know. So what are you doing that you found effective to promote women within your immediate sphere of influence? And since it's a related question, I'll ask you the second question. You know, you have been a gender champion, and what are some of the things you have seen that have worked to convert those who are probably not as enlightened as yourself? Some folks are gender blind. Some folks are gender hesitant, and some are just obstructionist. So tell us about your experiences of what's happening in the room when we are not there.
I'm sure everybody in the room feels sorry for me. But I think it's a difficult question. But the first thing I would say is that if I'm in a room where women are not present at the table, I think that's problematic right from the get-go. Because I think the best advocates for women issues, the most articulate advocates for women issues are women themselves. So we have created a very difficult situation, I think, in the world where traditionally it has been men who have actually sat at the decision-making table, and we definitely need to change that. And until we change that, I don't think we will adequately address women's issues. Because for me as a man, even though I may have good intentions, it's not enough. And actually, one of the things that I've realized in my career is that good intentions are never enough. Never trust people saying we have good intentions to change things and bring women to the table until you see a specific plan and a formalized process. So if people are saying we are looking for women, but to take up certain positions and can't get them, ask them for the specific plan to address that particular challenge. Don't just trust that there is going to be some kind of magical process that will work and bring women to the table of influence. So I think we need to change that, and we need to have very specific programs and specific goals to ensure that women are at the decision-making table, because only when women are making decisions are we going to actually change things. And then the other thing that I would like to point out is the issue of resources. Is putting resources behind what we are saying. It's all good to, again, have all these plans. But if, for example, you're working in an institution and there is no funding dedicated to addressing the issue of gender inequity, things are not going to change, even when the plans are there. They're going to sit there, but they're not going to be implemented. But if you put real resources and say, we're going to spend so much money, for example, to promote young women researchers, and this money is going to be ring-fenced for young women researchers, then I think we begin to shift and you begin to see a change. And so, just to be very specific, some of the things that we have done, for example, in the Sub-Saharan African Network for TB and HIV Research Excellence, SANTE, was that we realized that a lot of women, for example, could not participate in scientific conferences, sometimes because they have young babies, young children. And, if you have a 6-month-old baby, you find it very difficult to go to a meeting in Nairobi. What are you going to do? And some of these are postdoctoral researchers or PhD students, so they don't have a lot of resources. So one of the things that we did to address that was to set aside some money for diversity, what you call diversity and inclusivity. And what we did with that money is to actually support a family member. It could be, for example, a husband or a mother or a father, to accompany that trainee so that they can go to Nairobi with a baby and have somebody take care of that baby, so that the baby can be breastfed during that meeting, but also the trainee is able to participate in the meeting. Another initiative that we did was, for example, we realized that postdoctoral research phase is very sensitive, because that's when you develop your career, and that's when you begin to get a name for yourself and establish yourself as an independent investigator. And we realized that when women take maternity leave, for example, they lose a lot of time and they cannot catch up with their male counterparts. So again, one of the practical things that we did was to set aside money to hire a technician 3 months before the postdoctoral fellow goes on maternity leave. And this allowed the work to continue even when this trainee or postdoctoral fellow went on maternity leave. So again, a very practical thing, and the kind of feedback that we have gotten is very positive on these issues. Just to very quickly add that these problems are systemic. They are very deeply rooted. They are cultural, and we really need to be very sensitive and educate ourselves and sensitize ourselves, all of us, both men and women, because actually one of the challenges that I've noticed also is that it is not just, sometimes we talk about women and the problem of young children, and you think that's only where the problem is, but actually it's even the other way around. Sometimes we discriminate against women scientists who have chosen not to have a baby. So women are stigmatized when they go out for maternity leave and have a baby, and there are cultural expectations that they will have a baby. So when they don't have a baby and they are scientists, we also stigmatize them and say, why is this person not getting a baby? Is it because you're just so much dedicated to your work? So there's a lot of these cultural pressures on women that we need to educate ourselves to help ourselves to get rid of these stereotypes of what women should be and let women be.
Absolutely. I think in the US, they say damned if you do and damned if you don't. And that's kind of how it feels for a lot of women. So we're going to round out this series of questions with you, Katherine. We're going to go global since you're at WHO. You're the head of global ethics and governance. Please, can you explain to us why ethics and governance matters for research and how gender is intertwined into your work?
Okay, I really like this question because normally when you discuss ethics around research, people focus primarily and only on research ethics committees, which are critically important. And actually in terms of gender issues, one of the ongoing problems we have seen in COVID, I have responsibility for WHO's headquarters ethics review committee. I have also recently held a meeting with 30 ethics review committee leaders around the globe. And one of the outstanding issues that's still happening in research during COVID was the systematic exclusion of pregnant women and lactating women from research, even though all the guidance is heading towards a presumption of inclusion, not exclusion. So we have a translation dilemma, which takes me to the bigger issue about ethics. And I'll go back to COVID because I've been buried in COVID for the last 2.5 years. If you look at COVID and the language that's used, what do you have? Solidarity, equity, access, inclusion, exclusion, vulnerability, lack of access, transparency, exclusion, vulnerability. Vulnerability is a double-edged sword. That's all ethics language. That's all ethics values, ethics challenges. Have we succeeded in all those challenges? Clearly not. Vasimodi, my colleague, yesterday stated COVAX, I think was the stat, 3%, I think, uptake in some countries of vaccines. They were only able to get 3% out. We've clearly failed. Ethics matters because we're not heading in the right direction in terms of global health justice. It matters because inclusion is an ethical issue. I think on the back of what my colleagues have said, I've really enjoyed the honesty of the discussions, and I have a lot of empathy with the being a mum guilt and work. What do we at WHO need to do about this? So we produce normative guidance. I think that normative guidance is critically important. A lot of our power is soft power. It's only things like the IHR where we have hard power. But the development of that guidance is critical. The inclusion of gender, of cultural diversity, of different types of expertise. That's really important in our guidance development. And that, I think, which we've heard a lot over, including end users early in the process, will mean you'll get better outcomes. And the same has to exist for WHO's guidance. And that's the kind of thinking we're doing in the ethics space with our ethics guidance. How do we embed ethics early in the process? How do we embed values in our guidance documents? But most importantly, I think in terms of gender and ethics, what are we doing in terms of implementation? How are we implementing these policies? So the example I just gave you of the exclusion, even though we know that there's a presumption in favor of inclusion now, what are we going to do about that? Well, we're going to take a leaf out of some of the Global Health Network and some of the initiatives that have already been mentioned. We're going to do some train the trainers. We have to train researchers as well. This is not just about ethics review committees. So I think working together with our regional and our country colleagues, as well as we've got 13 WHO ethics collaborating centers, including one here in Stellenbosch. And I think really focusing on implementation. And for me, thinking about my responsibility for gender inclusion, my responsibility to stop that exclusion. What can I do in my position? And I would challenge all of you as researchers, all of you in this community, we all have a responsibility to be able to stop that type of exclusion. And I'll stop there.
Fantastic. Thank you. So this has been such a wonderful and engaged audience. And so I'm going to say a few things and then hand it over to the audience to ask questions. But also, I think it was such a wonderful opportunity. And thank you, Trudy, for this panel, which is quite different, not just at this. I go to a lot of conferences, as you can imagine. And we don't really have a lot of opportunities to have these kinds of candid conversations. And we need much more of that. So just in conclusion of some of the things that I've heard, there's a lot of work to be done for sure. We need to empower individual women. We need to change organizations so that we can present as our authentic self, be that mother, somebody looking after parents, somebody who is a person of color, somebody who identifies as a different gender, whatever it is, however you want to present should be not just fine, but embraced. And that's the organization that we want to work for. The reality is there's a lot of advocacy that needs to be done to change societies. Sometimes you need to force the issue, and that's through law or policy. Quotas, personally, I'm a big fan of, I think somebody mentioned affirmative action and quotas. People squawk when you say that, but the reality is it has never been a level playing field. And so oftentimes I think it's appropriate and fair to help level it out a little bit more. So with that, I just want to open it up. I know people are running out of gas or fuel, as we say. I feel like I'm bilingual. Sometimes I speak American and sometimes I speak English, proper English. So yes, just want to open it up and okay, we'll start in the front here. So 1, 2, 3 women in the middle, please come forward so that we can hear your questions clearly. And if you want to direct it at somebody, please do so. Okay, sorry, we have 2 microphones. We'll start with, I think you had yours first, and then you go second.
Thank you very much. My name is Donna from Amref, Health Africa. Of course, I work with Dr. Lakati, but my question is to Katherine. And you've talked about policies and laws and the importance of that. And my question is, what would you want advocates, the key messages you would want advocates to use to promote, research in science and in health? What are the messages you need us to use so that we promote and ensure that the laws and policies are implemented?
It's a great question. And thinking about this earlier in sense of some of what we've heard today, I think implementation has to be both top down and bottom up. So I was really interested in the Women in Data Science initiative. I think we need to harness the networks that are out there. And I'm looking at Trudy because the new network, I thought to myself when that was announced, that is something that I could harness for help with implementation in policy making. So that would be one level. I think the bottom up is really important because this is a systemic cultural issue. So for policy implementation, I would start definitely with the network approach. And then, as I said, because we're a member state organization, we'll work with our regional colleagues and our local country officers. One of the pieces of work we're looking at the moment is implementation of the human genome editing guidance. And we're working with the Uganda country office, and we'll work with the ministry. So I think it has to be approach of bottom down and top. Bottom down, yeah, and top down and bottom up. That would be right, wouldn't it? That's the word. It's a long day, and I was the last speaker. Could have been worse. So yeah, but I definitely think harnessing pre-existing networks will be critical for implementation of our policies. And I will be looking to Global Health Network, and I'd be looking to some of the colleagues on the table to help with the policy implementation.
Thank you. Go ahead.
Thank you for a wonderful session. I'm sure it was eye-opening for others. My question is, it's actually a question combined with a comment, especially for the organizations which are normally putting out calls for research fellowships. There's something called, I don't know if it is there yet, but some people experience it, like age discrimination that normally would affect women, whereby a call will be put out and an age limit will be put there. And you have a woman who has just maybe, she was feeling she was having mother guilt, so she decided to take care of the children. Now she's ready to come back. But now when she looks for opportunities, all of them are saying under 40 or under 45 or under 35. So where is she supposed to get the same opportunities? Does it mean it's the end for her? And what can you do about it? Can you be the people who are championing for others to see that you're not actually putting limits, but you're actually only considering the capability of the woman? And my second question is, what should be done in the cases where, so I don't know if this is only in specific areas or in Africa, where you find young women, the people who push them down more are not necessarily men, but women who have reached, women who are at positions of power. They are the ones who put down other young women because they feel these women have maybe too many opportunities and they're not working hard enough, or they're the ones who will tell you, no, you can't do this. So what are some of the things we can do to be able to change this? It can be a mental attitude, or maybe they don't even realize they're doing it. Thank you.
So perhaps, Cristiani, you want to take the first one, and Lyda, and then perhaps you and Alice as well, given the Africa nature of the question. So we'll have the first four panelists respond. Really great questions. Thank you.
Well, that was a really important question about what kind of action can we take. We have already talked about regulatory measures, financing, and we shall have affirmative action in different ways to avoid discrimination and to promote more diversity. We are worried about this in my institution, for example. We are trying to adopt some criteria to convince people that they have to include diverse criteria in selecting people and promoting this. We are worried about this, even when we are selecting girls through scholarships. So we have some programs that we are trying to adopt different criteria to select girls in the community, girls from poor communities to engage in this project. So we are adopting this kind of criteria. And another important issue is that we have to talk about that with all people, inside and outside the institution. We have to talk in the schools. When we have these programs to bring girls, the more girls in science program, and to show how science is and to engage them in our scholarships and so on and so forth, They want to talk about everything, about every kind of difficulties that they are facing in the families, in the communities. And it's important to talk about everything because they have many obstacles, especially very poor girls, in the case of Brazil, Black girls from peripheral areas, from poor areas, because Brazil is a very unequal country, and Black girls and Black women have a lot of difficulty. So we have to talk about this, and we have to include these affirmative actions in our policies and initiatives and strategies, and to talk about that with people, because people sometimes doesn't notice that they are committing injustices, even in selection process and so on and so forth. And even in my institution, sometimes I see there is this panel with 7 white men. I call the person, how do you manage to organize a panel with 7 white men? That's absurd. We can do this and put there our symbol, our name. So we have to talk about this and to problematize this kind of issue. And that's for now, and I will keep here.
Thanks for the question of the calls for fellowship and scholarships, because this is a very easy way to make a change. And I think it has been now more current in calls that the issue of gender is being addressed. So there are like 2 indicators that I usually look after when there is a call for fellowships or scholarships. First is the amount of women that apply, and the other with respect to men. And the other is the proportion of those that apply that are successful. So usually the biggest gap is in the applications. So there is less women who apply. There is a gap also in the successful rate, but this is usually lower than the applications. So one of the reasons we explain it very well is the age limit. And for that, usually the modification is to increase the age limit. And I witnessed that has been done in the calls at the Ministry of Science and Technology, for example. The calls are usually had increased the age from 30 to 35 or even in the 40s. And I have seen that also in TDR calls that I've been part of, some of the committees. And the other strategy that was used and was part of that was to mentor women through the application process. So we have a list, at least this was in TDR, a list of women, usually women to mentor women. We offered to mentor women who wanted to apply. And there was a link in the application webpage that women who wanted to apply could ask for some mentoring and guidance in how to write the essay or put up their CV, etc. And I have been part of that. So not always successful, but it has been a good process that to give usually is the confidence to do it and have some experience in how they can be more visible successful during the application process. I think the success rate comes very much to the training, and the training has been affected also for the some of the issues that were discussed earlier during the panel. So for that, we need to have better ways that women we can be trained and be trained while we are with the family. So because at the end of the day, what it's been assessed, the criteria are the same. I'm not expecting that we have different criteria. I don't think that's what we want. We don't want different criteria for selection, but we want the opportunities to have the same CV. So we need to improve that capability to be trained and keep up with their CVs while we are, for example, in maternity leave or have care for others as well.
Great, thank you. We're running out of time, so I'm going to ask all the panelists to weigh in because it's such a great, important, relevant, real question. Have everybody weigh in, and please kindly make it brief because I think there's 1 or 2 more things still on the agenda before we wrap up this fabulous, fabulous convening. Go ahead, Aliya.
Yeah, it's me, Aliya.
Yes, Aliya, just we're gonna go through, everybody's gonna answer the same question very briefly.
Can I go?
Okay, go ahead, go ahead.
There goes the man again. What I wanted to address is that the issue of the women sort of suppressing women, if I may put it that way. I think personally, I see it as a cultural issue and systemic issue. That's why I was saying that I think if you come from a patriarchal society, as most of us do, you have this even unconscious bias that you might have some unconscious bias against women. And so it has to be a very intentional process to actually support and empower women. And this affects both men and women. And this is what makes women empowerment so difficult. And therefore we have to constantly dissuade ourselves of this idea and this concept that is so culturally ingrained, sometimes even in our unconscious, that women somehow cannot do certain things because we have to support women. And we have to realize that this kind of bias comes both from men and women. And we have to fight against it. That's what I wanted to comment.
Very, very quickly, everybody else, please weigh into both. There were two really good questions, so you can weigh into either.
Thank you very much for raising that question, and I'm glad that we are having this conversation because the challenge of those cutoffs are actually worse for African countries because if you look at our education system, you finish medical school sometimes even at 25 years or 26 years. So by the time you start your career, it's really late, and therefore that really disadvantages women from sub-Saharan African countries. And I'm glad that the panelists are thinking about this. And my thoughts are, it's true, we have had situations whereby women put down women, but I look at that there is light at the end of the tunnel because at the moment we have more women also supporting women. I see in my organization, we have even formed a network of women to discuss women progression in careers. So we have an opportunity to come together and address some of these things that my colleague actually is saying, they are cultural. Because sometimes older women feel like maybe depending on their experience, and sometimes it's unconscious, but I think there is an opportunity, and the fact that we are discussing this is really an important thing for us to move forward. Thank you.
Although we are blaming the culture, I had the opportunity to work with many people as my mentor who were coming from different culture, different nationalities. And I have seen this in my career and other careers, that there is a tendency to not to support women. It can be women, but not always women. It can be men as well. And I personally don't think it is women trying to suppress women. I think it is true for both men and women, young people who are developing their career. When you become a very good team member, a boss really wants to keep you there. And if you try to get promoted to something else, this is a loss of investment on their part. I'm telling you this is the reason for this barrier, this ceiling. And when it's what you do, you can do two things. I think everybody has to face the situation in such certain magnitude at any time of the career. I think the first thing would be have a dialogue, open discussion. The best thing you need to talk about your expectation, your dream, your career. That men do that a lot because men have boys club. These boys talk to boys and they are empowered and they share everything. Girls don't do that, unfortunately. Not in my society. I don't think any society, girls have a girls club where they share everything. I think this is important to have a dialogue, understand what are their expectation and what is your expectation. And if it doesn't meet the same pathway, just choose a different pathway and say it honestly. Being honest, open, and show them you have a dream and you want to follow that. So there is no magic bullet to solve everything. It depends on individuals' personality characteristics. But as a woman, what I would say from my experience, they are always hesitant to talk about their need, to talk about themselves. So you have to come out of this period, of this cocoon, and you have to talk to them and never ever give up your dreams. Follow your dreams, believe in yourself. You have extreme power that you can make a change because you have to dream, because dream comes true. So never be disheartened. This will be a situation every time in your life, either a junior, mid-level, or senior. We also face the same thing in our state of career, right? So this is a challenge. The more you crack this challenge, the stronger you become. So take it as an advantage. Thank you.
Thank you. Thank you, everyone. I think we're going to end on that very inspirational note. Sorry, we didn't have more time, but we've if she had a hook, she would have pulled us off. So
I was sitting there being a little bit female, thinking, dare I get up?
no, thank you, everybody. Thank you to this wonderful, wonderful panel for your honest conversation. Thank you. Bye.